Well, I'll try to break it in the simplest possible way. There are three main routes, and all to do with your age, type of prescription you have, the healthiness of the eye, your expectation, and your lifestyle, what you're looking for. So if I start with the first option, that is the laser vision correction. Here, simply we change the shape of the cornea, reshaping the front window of the eye to achieve the target results you're looking for. And that's suitable for younger patients looking to get rid of glasses, be less dependent on glasses, contact lenses. Obviously, the cornea have to be healthy, have the right shape, right thickness, and right tear film, because we have to ensure that or maintain the health of the eye after surgery. We want to minimize the risk of having a long-term problem after surgery. Not only about give you the best result, but give you the safest option. The second option would be ICL, that's implantable collamer lenses. These are like a contact lens inserted permanently inside the eye. You don't see it, you don't feel it. It's just sitting behind the pupil and improve your vision. And this is especially important for patients who have unusual surface of the eye, such as thin cornea, the cornea is not a regular shape, or the prescription is very high. It's one of the safest options nowadays to correct those high prescriptions. The third option would be refractive lens exchange. That is when we replace your natural lens with a better lens. When the natural lens starts to age 50 plus, then it loses its function. You start to lose ability to accommodate, to read, start gradually losing contrast, losing ability to distance, and so on. This is when lens exchange become a good option. And depends on what type of lens we do, that decide the outcomes. So you could have lenses give you good distance vision, distance and middle, or lens give you all the full range of vision, such as distance, middle, and reading vision as well. The safety of intraocular lenses have to be measured carefully, and it's a choice of lenses. It depends on what's your motivation, expectation, your lifestyle, and the healthiness of the eye. The main goal is not to ditch glasses. The goal is to give you that freedom and confidence to do things you want to do. You want to drive, exercise, do gardening, enjoy the readings, when you don't want the glasses to be in the way to enjoy those activities. The main goal is to give you clear distance vision without relying on glasses or contact lenses. So if you have a myopia, hyperopia, or astigmatism, then that is, as a start, as an indication for laser vision correction. We have to make sure that the cornea is healthy. That means it has the right thickness and the right shape. We have to make sure that you don't have dry eyes, so you have a healthy tear film. You don't have any inflammation on the eye surface. We have to make sure that you're in the right age, and make sure that you have enough understanding of what the laser vision correction entails. The laser vision correction works by reshaping the front window of the eye, that is the cornea. And we know with age, the changes happen in the level of the natural lens. So if you are age 40 above, you might experience difficulty in reading as well as your prescription. That's called presbyopia. Hence, if you want to do laser vision correction and you're age 40 plus, we might have to do some modification. Some patients might be suitable for what we call it monovision or blended vision, where we give you one eye good for distance and one eye gives you more reserve for reading, so help you to continue be able to see distance and read throughout life. So it is a combination of lifestyle goals, your expectations, and the healthiness and the structure of the eye. All together make us make the right decision if laser vision correction is a right fit for you. Well, if you have a high prescription or high degree of astigmatism, or if the cornea is thin or not regular shape, meaning make you unsuitable for other type of refractive surgeries, or if simply you have a dry eye, then ICL is a great option. So ICL work by implanting that very thin biocompatible lens behind your pupil. That's different from laser vision correction, where we reshape the cornea. Meaning that this is addition to your eyes. This is not changing or reshaping any part of your eye. So if for any reason lens had to be removed or exchanged, then that is possible. So in future, if your natural lens start to age and you start develop cataract, then ICL can be removed and would have a normal cataract surgery, whatever type or choice of lens implantation. I often perform ICL for people who run a very active lifestyle or those play sports, even at a higher level professionally. With ICL, you get excellent visual outcomes, high safety profile, very good visual quality without the need of glasses or contact lenses. Lens replacement surgery is a great option if the natural lenses start to lose its function. Normally with age, you might find that you start struggling to read. That usually age 40 plus. Gradually, you're having difficulty in seeing in a low light condition. The contrast become affected. You find you making more effort to focus. You might find the glasses need to be changed quite often. That means your natural lens start to age. In this age group, it's not about reshaping the cornea and doing laser vision correction. The problem here is your natural lens. So replacement of the lens is a treatment of choice. And it really depends on the type of lens implantation you will have. If we go for monofocal lens implantation, that gives you fantastic distance vision and you need glasses for other functions. However, if you choose something more premium complex lens implant, that gives you a wider range of vision, something able to help you to see distance and read at the same time. The choice of lenses is very critical and rely on what's your expectation, your lifestyle, how healthy is the eye, are you suitable for those premium lenses? All that come together to give you best quality vision you're looking for. And I finished to say that refractive lens exchange surgery is exactly the same as cataract operation. So in fact, when you have the surgery, it's not just corrective, it's preventive surgery, so you're not going to need a cataract operation in the future. First, I assess how healthy is the eye, the structure of the eye. I look at the eye as a camera. Is the eye optically a good camera? I look, is the eye healthy? I look at the shape of the cornea, the thickness of the cornea, the tear film. Do you have any dry eye? Anything need to be addressed before we perform any procedure? Then I look at the rest of the eye. We perform what we call it a biometry. Look at all parameters of the eye. How healthy is your natural lens? Is there any signs of aging of the natural lens? How healthy is the back of the eye, the retina? Once that all performed, we have a good chat to know what's the goal, why you want this surgery. Are you looking for freedom to do sports? You want to get rid of glasses for reading? Is it about having better distance vision or other things? This is an important part of discussion. Knowing your motivation for surgery is important. And also your expectations. What are you expecting? Are you someone looking for total freedom of glasses? Or are you accepting some additional glasses to sharpen the vision for those specific tasks? This is all count into the discussion before we decide what is the right option for you. Safety always comes first. And also transparency is essential. I discuss with you all available options, what is suitable for you. And we talk about the benefit and risk of every option and we compare all the options together. And then together we decide the right option for you. When eye health, your expectations and needs are aligned, then the right treatment becomes clear. When the right patient has the right treatment, the results are usually excellent. Most patients achieve excellent distance vision. In fact, many patients are free of a glass of contact lenses. And the majority of patients become less dependent on glasses and contact lenses. Now you need to understand that this is not just about the eye, it's about the brain. When you have a treatment, especially if it's correct distance and reading at the same time, it might take some time for the brain to adapt. This is what we call neuroadaptation. Neuroadaptation takes some time to develop. It can be weeks, can be months. And that's why it's very important that when we plan the treatment and discuss your option, to talk about neuroadaptation. This is your expectation and your patience to allow the brain to adapt to the new optics. When the treatment is carefully selected and you understand about the adaptation process, then it's not just about a clearer vision. This is about your confidence and your long-term satisfaction with the outcomes.